Good morning. I'd like to call the Monday, December 9th, Human Services Committee meeting to order. First item on the agenda is the approval. We have motion and support. All in favor? Aye. Opposed? All right. Moving on next to public comment. Are there any individuals that would like to make a public comment? Public comment? All right, next moving on to committee items. We have the minutes of our November 12th meeting. Looking for a motion to approve those or any amendments? We have a motion and support. All in favor say aye. Aye. Opposed? Motion passed unanimously. Up next we have the Lifeways monthly report. Mary Beth?
Good morning, everybody.
Good morning.
An update this month in regards to what's happening at Lifeways. For first thing to note is that there have been meetings and discussions with the county in regards to correspondence, follow-up from the correspondence from the department related to local funding, and we're working on some strategies. So those discussions are happening both with Jackson and Hillsdale County. The other important thing to note in your packet is in regards to the critical needs assessment that's being done related to some capital needs for our building now that the county is part of our facilities. We had a power outage about a month and a half ago. They created some issues, and there's some ideas that the county has related to how they might be able to partner with us to resolve that and prevent any future potential risks. So we're working on that. The other thing that's happening is we're continuing to work with CBRE in regards to the vacant space in the front of the building. There are three important things, and I've talked about it here before, in regards to the regionalization and the potential impact on Lifeways and local service delivery. So I'd like to talk about those. It's in your packet, but just again to give an update since the last time I presented. The first one is related to the local funding, and there is the code that currently requires that the Medicaid match that the community mental health pays to draw down those additional Medicaid dollars be the requirement of the CMHP. There's a lot of discussion and advocacy, and I was part of a Republican caucus that was held last week in regards to advocating for the fact that that requirement no longer be placed on the burden of the counties, that really should be a state obligation and not a county obligation. And we had a lot of discussion about the fact that this is creating hardships for counties, especially when we look at over the past 10 years. This was put into place 10 years ago, and there's a lot that's changed in 10 years in regards to revenues that counties receive, as well as changes in their obligations for those funding. And I'm advocating, and so are my partners, directors within our region, that be changed. So I just want to let you know that we're doing that advocacy on behalf of both counties and hoping that will have a significant impact. The other thing that is having an impact is related to general fund. With Medicaid expansion, there is the projection that when that happened that there would be a huge savings to the state on the general fund. And I'm speaking specifically to the funding that comes directly to the CMHs, our general fund dollars, because they had made assumptions that all of those individuals would immediately be covered under the expansion. Well, that's not the case, because in the expansion there are services that are not a benefit that we provide for those in our communities. And the projection is that there's going to be a 70% cut in our current general fund. This past year, we've had to implement a waiting list because of our general fund. The needs of individuals of uninsured in our community is increasing, yet our general fund dollars have decreased, so we've had to put on a waiting list. There's huge concern, as you can imagine, a 70% reduction statewide for those general fund dollars which are used in our communities to serve the uninsured and also to provide services like in our jails for diversion. That this is going to have a negative impact in our communities, and that the state needs to be sure that some of those assumptions may not necessarily come to fruition related to the fact that all of these people will automatically be covered under the expansion. And so we're advocating for that, because if this does happen, it's going to be critical to our communities related to the services that Lifeways provides. We would be at the point that the only thing we could provide is crisis inpatient. That's it. I mean, we do know that if we can do things to provide diversion services, prevention services for individuals, we can keep them out of crisis. So I want you to know that that's occurring and that there's advocacy for the fact that general fund dollars need to stay in place. And if I could get support from the county when they have discussions with legislators around that, that would be important for those that we serve in our community. The other key thing is related to, with regionalization, we've talked about the fact that the Medicaid rate is going to have an impact because there are poorly funded, like Lifeways, and higher funded CMHs within our region, and that the state really look at, with these additional Medicaid dollars coming into the state under the expansion, that they look at creating an equitable rate across the state, because there should not be a disparity in 200% of funding between those richer counties in the state of Michigan and the services that they can provide versus the services that Jackson and Hillsdale can provide. You should be able to go to any county and receive the same level of service and same access. So we're advocating for that as well when we had our meeting last week, and they're hopeful that the state will take this opportunity to correct some wrongs as it relates to how the system has been funded over the years, because it's based on historical use, not on the level of need of communities. So those are the major things happening. Are there any questions related to my reports or anything that I've presented?
Commissioners? Commissioner Duckham?
Yes.
Thank you, Mary Beth, for this information. On the CMH, yourself advocating for a change in the state, the way it's funded.
Yes.
How long do you think it's going to take to turn this around if we can convince them to do that? Is it going to be a 2 or 3 year deal, or are they receptive?
We're hoping it's not a 2 or 3 year deal. I mean, it's going to be critical to our communities. It can't be a 2 or 3 year deal. We're hoping that they're going to actually pass a supplemental bill here shortly. Either if it's not right now before the holidays, that they'll pass it within in the February turnaround.
That quick? That's good.
Yeah,
okay.
We're hopeful. I mean,
and the general fund,
yes.
when you're experiencing the 70% reduction, that comes from state?
Yes, those are state general fund dollars, and those dollars are used to serve the uninsured in our community, those individuals who do not qualify for Medicaid.
Thank you.
Mm-hmm.
All right. Commissioner Shotwell?
Yes.
Mary Beth, who's making the decision on who is representing Jackson and Hillsdale on the regional board? Will you be making the appointments and then sending them back to concurrence to the county boards, or is Lifeways making those appointments independently?
The bylaws that were established for the regional entity established the fact that the appointments would happen at the CMH level. The CMH board, so Lifeways' board, made recommendations for the appointment, and those appointments have already occurred. So we do have 2 representatives from Lifeways who sit on the regional board entity, and they've been meeting now maybe about 4 months. Ed Woods and Brad Boner. Any other questions?
Commissioners, any other questions, comments? All right. Thank you, Mary Beth.
All right, thank you.
Next on our agenda from the Department of Aging, we have Deputy Director Kara Lorenz. Welcome, Kara. Now, did Marcy forewarn you that we really are a nice, friendly group, or did she tell you evil stories?
No. Good morning, everyone.
Good morning.
So I'm here reviewing Marcy's report this month. So I'll just briefly go over the different topics. First on the report is the topic about federal sequester cuts. The Michigan Office of Services to the Aging has not heard information related to the 2014 Federal Administration on Aging budget, which began October 1st. So OSA, the state, does anticipate at least 5% of sequester cuts to their funds. What this means for our department, these sequester cuts are in addition to the $25,900 of cuts we received when we submitted our grant proposals to Region 2 earlier this year. And also, due to the unknown, OSA notified Region 2, who gives us our grant funding, to reduce 18% of federal funding until further notice. We're planning accordingly, and we have submitted a budget adjustment for December. We're hoping, not expecting these cuts to come through quite this high. And then the next topic on the report is related to our home care assistance grocery shopping. Some of our Department on Aging home care clients, as you could imagine, have very limited resources and heightened physical needs, which makes public transportation a very difficult option for them. Our program provides a home care worker for these clients 2.5 hours every other week, and many times the client has to choose cleaning or grocery shopping, one of the two services. Our department has a high-performance organization work group that focused on expanding services, and they recommended having volunteers to take these clients to the grocery store. This would obviously allow our worker to focus more on the cleaning. That group developed a wait sheet to more clearly identify the clients with the high transportation needs. And then Marcy Wandell and Danielle Paquette, our in-home services coordinator, did meet with Pam McCrum-Perez at RSVP, that's obviously the Senior Volunteer Program for Transportation. And they discussed the possibility of RSVP volunteers taking these Department on Aging home care clients to the grocery store if the Department on Aging paid the mileage. Pam said that this is possible depending on volunteer availability, and they're talking about details now. So then there's just a couple of fun facts on our report. The Crouch Senior Center did partake in the Night Lights Winter Wonderland tree decorating contest for nonprofit organizations. People vote on, that obviously is at the American One Center. People vote on it monetarily, and you can bid on a silent auction to receive the tree. Money donated goes to the department. I actually took my family through there this weekend, and it's pretty nice. It was the first time I got out of the car to go through this event center, so that was nice. And then there's our wood carving groups from Crouch and Spring Arbor made a nice wreath with some ornaments, and Marcy attached pictures of that. That's all.
Commissioners, any comments or questions for Kara? Commissioner Rice?
Hi, how you doing?
Good.
Marcy and I have been talking about this for quite some time, so, but maybe you can answer this. The Leone Township Senior Center, where there's been issues about whether or not the seniors are going to be able to continue to attend there. I know there's been some negotiations. We've tried to, we've contacted numerous places throughout Leone Townships, from churches to private places, et cetera, and we've gotten nowhere. Do you have a current status on that?
As far as I know, it's where you think it is, Commissioner Rice. They still are just really looking for places. I know the list is quite lengthy as far as different places, and it may have been related to the barrier in the building, physical barrier for seniors, that sort of thing, but I don't think they've gotten any further that I know of on that topic.
All right, thank you.
Yep.
Any other comments or questions for Kara? All right, thank you, Kara. Next on the agenda, we have DHS Quarterly Report.
Good morning, everybody. I wanted to call to your attention that I had neglected to put in our statistics along with my report, so I sent those over this morning. I don't know if everybody got those or not.
They are current on the website,
Okay,
yes.
Great, thanks. I'll just go through that really quickly. Our Family Independence Program, that's our cash assistance program, is held pretty steady. Over the last year, it is down about 300 cases, well, a little bit less than 300 cases from last year, and that's due to the time limits for folks to be able to collect cash assistance. Medical assistance, that's our Medicaid, that's held pretty steady. State disability is held pretty steady as well. Adult medical program is up from last year. That's a result of there being an open window for enrollment last year, and it was only open for 1 month, but it remains higher than last year. Social Security has held pretty steady as well as the food assistance program. It's held steady from the last year. It's down about 1,000 cases from last year. Daycare is actually held pretty steady, but it's down from last year. I think that's a direct result of the cash assistance program also going down. And state emergency relief is down because there was a change in our application process. We do not offer state emergency relief except for the month November 1st through the end of March. So people were not allowed to actually make applications in October, and they were aware of that. But they jumped back up again, close to 1,000 in November when that opened back up again. Adult community placement remains fairly steady. Children's community placement is at 341. That's up a little bit from last month and up significantly over last year, but we've been talking about the number of children in foster care and institutional care having gone up over the last year. Juvenile justice cases, we have 2 open right now. That's held pretty steady. Prevention services, we have 7 cases. We hope to have more prevention and less children in care, so that's the direction we'd hope to see that increase. Bless you. Children's Protective Services has been very busy, again, with school opening back up and up over last year and up over the last month. Independent Living Services, again, that's adult programs. That is also held fairly steady. And you can see our reception traffic in our lobby is actually down over last month and significantly down over last year. We believe that's a direct result of the online application process that we have now in place. We have less people coming in to apply, and they do that online. I did include the County Child Care Fund statistics. I don't know if there was any question to that. If you see that, we are, again, still holding high as we were last year in the County Child Care Fund. We had a total of $163,846.66. That's actually up over last year's average. So we are, I guess what I call attention to is if you look at the number of children that in that box to the right, it says that there are 24 children that DHS directly supervises in foster care, and there are 35 children that private agencies supervise in foster care, for a total of 59 children in foster care. And that's the total expenditure for October was $88,626. We have 8 children that are in institutional care, and that was a cost of $75,248.46. So it's pretty close, the expenditures for children in institutional care, as even though you have about 6 or 7 more times number of people, kids that are in foster care. So we're looking at that closely, evaluating that on a regular monthly basis, those children in that care, and if we can move them to a less restrictive placement, that's what we'll be doing. Are there any questions about the statistics at all?
Jerome, if we look at those, the 8 individuals, because those are significant costs, what is the length of time normally the child is institutionalized for?
9 to 12 months. So I would like to say I hope that as those children come out, those costs would go down, but other children then come into care that need institutional care as well. So we kind of, as some come in, as others come out of institutional care and go back into foster care placements or their own homes, we get new children that are in care.
Okay.
So that's a difficulty of.
And then in regard to the very first page of stats, that first program was Family Independence Program, and you shared with us in October 2012 there were 1,093 cases, and in October you had mentioned the 713 and the difference of about 300. My understanding then is that's because they're no longer eligible due to the state time limit?
And federal limits of
State
60 and
limits.
48 months, yes. And so those children, those families are no longer eligible for cash assistance.
Okay. Commissioners, what comments or questions might you have? Commissioner Shotwell?
Yes.
You had shared with us in 12 your staffing levels were just getting to full. Have you been able to keep staff and maintain staffing levels at an adequate level for distribution of services?
We're close. We've had some recent turnover in staff. We actually were able to add an adult services worker this year, which was something we haven't done, I would say, in the last 8 or 9 years. So we actually went from 6 to 7. And so in that process, one of our workers that was a foster care worker moved over to adult services, so that left an opening there that we're trying to fill at this point in time. We also added 3 more Children's Protective Services positions this year due to the number of cases that we've had, so we're in the process of trying to fill those as well. It's a little bit more tedious process because what we have to do at this point in time, before we can look at hiring new people off the street, we have to look at other overstaffed counties, and if they have overstaffed counties, then those individuals are expected to move to an understaffed county, so that's taken some time. As you can imagine, there's people who have homes and are paying rent and those kinds of things and jobs and don't really want, or they may be in a lease agreement and don't want to really move right now to another job, so it's been a difficult process. It takes a little longer. But overall, we've held pretty steady. We did pretty well last year. We just have some new positions and some change in our staffing, so we're trying to fill those at this time. I'll just quickly go through the report that I prepared. We have had as I look back in that, we had a all-staff meeting, right, recently. And preparing for that, I saw how many changes that we had in the last year in our office, and I shared that with them, and I share that with you today. One of the things we did is we went to a fully automated application process for assistance payments, and we really have pushed that. We have 4 people working in our lobby that help people apply, and we have 12 computers in the lobby. And what we do is not only have them apply there, but we try to do a teaching process so that they wouldn't even have to come into the office. They can go to the library or other areas where they can apply for assistance. So we're really happy with how that's going. We actually had some folks come down from Lansing recently to study how we're doing that and want to use that as a model for the rest of the state. So it's actually going fairly well. We have a few people that are angry in the lobby over that process because of their fear of computers, but we've worked through that with them as quietly as we can. What we do is if they really are having a difficult time in the lobby and they're being very loud, we move them to a computer that's outside of the lobby and actually in our worker area, and that tends to bring things down, and they feel less pressure to when they're doing the automated process and while they're learning. We were looking at going to an electronic document management process or a paperless process for our cash assistance cases and our other assistance cases, but the system wasn't ready, so it's looking like it may be in early 2014 that we may move on to that. Our Children's Services computer program also wasn't ready to go. We were supposed to go with that in October of this year, but it looks like it'll be March or April of this coming year before we'll be able to bring that system up. We redesigned a couple of areas in Children's Services and in payments areas to try to make things more efficient. Our staff appear to feel that that's been helpful. We're hoping that we put people in work groups, that they're closer together, they do similar work so that they don't have to get up and move around the office as much, that they can actually do their work, and actually it cuts down on the amount of actually having to travel from one part of the office to the other. So that's actually looking pretty good at this point in time. All of our Children's Services staff are fully mobile at this point in time, and our Adult Services staff have gone mobile as well. So that means that we see less of them in the office, but hopefully it's more efficient that they just move from place to place in the community. One of the projects that we also had last year was reorganizing our filing area, and we've actually purged many files and cleared that area out and reorganized. We have a lot less in the way of lost files, and it's much better organized, and our staff did a really good job with that. We didn't get any additional hours or staffing to do that. They just made it a project and did a nice job with that. Right now, we're in the middle of our Angel Tree program. We actually have 440 folks that have adopted children in foster care and from families that are that are disadvantaged that do not have funding for gifts this year. And actually this morning they started picking those up this morning. So we're really pleased with that. That's 40 more than we had last year. So in a difficult time, I think people have stepped forward to help. One of the other projects that we have going on at this point in time is a juvenile justice school cooperative that we have going on. What we're looking at doing, hopefully, is reducing the number of truancies, dropout rates, improving attendance in school. We're also looking at working with mediation in the juvenile justice system to reduce the number of children that are going through the juvenile justice system, and actually trying to work closer with those families by identifying them earlier on in their educational process and working with them more intensely. We will need to, we've met as a group several times, and we're hoping to put our plan together. It has to be in by this Friday for the state to be part of the state task force. I hope to be able to report that we're having good results with that next year. We actually are looking at expanding our court mediation for eviction program. We've been doing that with Judge Mazur, and actually several other judges have seen that it's had good results. We've had less evictions, and I believe at least 2 other judges have asked to bring that into their courtroom as well, so we're going to expand that as well. I've been meeting with the steering committee for the Child Advocacy Center, and we're working on accreditation, which hopefully gives us long-term stability with the Child Advocacy Center, and we hope to have that turned in and hear about our accreditation sometime next year. So working hard on that as well. And I wish you all a happy holidays.
Thank
If you have
you.
any questions for me.
Jerome, if I may start, you mentioned the task force that you have created, and you're going to the state by next week. Are there any funds to be allocated if or when an official task force is formed?
No, there are no funding or increased staffing. This is all about a collaborative effort amongst the community members that are all involved. What we really hope to do is have a consistent truancy document for the whole county, so that everybody is on the same page with truancy and absenteeism. And we're also looking, as I said, and working collaboratively with the court in a mediation process. So those things all happen without increased funding or without resources coming from the state. The resources that they'll give us is information being shared across the country. They're channeling that to us with ideas of how other counties throughout the state and throughout the country are having success without having to increase funding to do that.
Okay. And Jerome, I do commend you for the collaborative effort you're making. When I attended that meeting with you, it was very impressive to see the individuals sitting at the table that care about education and realize the value of having children in school to learn.
It was nice that they all attended. I really appreciated their support, and I'm hoping that we'll have some success with this. That's what I think everybody's there for.
I agree, and as commissioners, you would find the county very well represented, very well, at a variety of levels. So we had a lot of county individuals sitting there, which was good. Commissioners, any other comments or questions for Jerome?
All right. Thank you.
Thank you.
Have a happy holidays, folks.
Next up on the agenda, the medical care facility quarterly report. Sandy?
Good morning, everyone.
Good morning.
Under finance, our AR days remain 45, which is very, very strong, our AR days out. Most of the other medical care facilities in our district were at 60 or 80 days out, so that's very good. JCMCF is profitable year to date, despite our case mix being slightly off what we had anticipated it being and our census being just slightly lower than what we anticipated. Medicaid audits are currently underway for years 2010, 11, and Mr. Pop, who's doing our audits, has requested that he get to stay with us a little bit longer and do 2012. So it's to our benefit, so we are excited about having that completed. Our Medicaid payment will increase at JCMCF this year, again from strategic costing out of what we have to spend in our expenses, and because we also reached our 51,000 days. That allows us a little bit less tax payment in the bed tax category. Our draft budget for 2014 is nearly completed, and we are presenting it to the board this month. Under people, Assistant Administrator Janine Detloff has completed her required Eden training for our culture change venue in our building. M&A negotiations have completed for the year. They were the first union to fall under the right to work change in law, and those finally resolved successfully. We have also called a special meeting to meet with the AFSCME union to try and improve our bandation policy, which is written into their contract, to make a better work climate for our employees. Contract negotiations for their right to work begin in March of this upcoming year. We continue to hire to build our nurse casual pool, to reduce our overtime, and to reduce the need for mandation. We initiated a program to support staff with health concerns that we call the Healing Circle, and those that participate in that have benefited from that greatly. We've completed various evaluations for staff. I have done it at the director and manager level. And our United Way campaign, we are proud to say, was completed in about 2.5 weeks, and we met our goal. Under service, I was privileged to present at the American Healthcare Association again in October on sustaining culture change in long-term care. The presentation was very well received. JCMCF hosted officials from the Office on Services to the Aging in regards to assessing what to look for in changes that are person-directed care, culture-centered, or culture change homes. In Michigan, Medicaid representatives are supposed to be coming down, these are state-level representatives, to tour our home as being a model for delivery of Medicaid services, which I'm also very, very proud of. Under quality, the policy and procedure team met and reviewed routine policy changes as well as the new ones that we have added. Incident and accident reports were all reviewed, and resident council was attended to ensure that we hear all their concerns and that we meet their needs and make them happy. We facilitated our monthly quality improvement meetings and reviewed departmental and interdepartmental projects. We provided oversight and guidance during 2 recent facility reported incident surveys, and we're awaiting revisit on that. And we were asked again by the American Healthcare Association to present 2 proposals for poster trainings at the National Quality Symposium. One is on turnover rates, because our turnover rates are exemplary for our level of care in the healthcare system. And one is because of the reduction of the use of antipsychotics in nursing homes. We have a rate that is well below state and national levels. Under growth, we continue to implement our chosen electronic medical record, which is an undertaking to say the least. At this writing, CNAs are being trained on how to use the point of care and system, which is kiosks on the wall in each neighborhood. And then our nurses begin next week. Our strategic planning session was held in October with the board and directors, and at that meeting, all of our current goals were reviewed and their status, and we added a few goals and we updated our plan. Most of it was changes subject to the Affordable Care Act that we needed to address, and the communication of all those changes go to the staff next month. They're all provided with communication about the plan. And finally, I met with Plant Moran Cressa last week. They are the people that are looking at our newly acquired space to give us guidance on what would best profit our home and serve the residents of Jackson County. And I'm excited that when she went on the tour, went through the building, she was probably one of the most excited consultants that we've had. She was very pleased to see the area and the potential of what we could do to serve our residents. Any questions for me?
Thank you. Ms. Place, if I may begin, under the people section,
Yes.
could you give the commission some examples of what you're doing to work to build up the nursing staff casual pool?
We just hired 4 additional nurses again in the last 3 weeks. And what we do is hire really as many nurses as are interested in being there. And then we plug them in when we have a call-off or vacations. And we are doing that to reduce the need for mandation, so we reduce the need for overtime, and also to build up a pool that then if anyone is interested to take a full-time or part-time position, we can hire directly from our own staff.
Thank you.
You're welcome.
Commissioners, comments or questions? Commissioner Shotwell?
I wanted to apologize for not being clear on where we were putting the 911 center. I know there was a little consternation in your office.
That's a little heart failure on my end.
But I do appreciate your comments, and I think you're doing a great job, and it's been a pleasure working with you since you've joined us here in Jackson County.
Thank you so much, and thank you for having that corrected.
The old Joey's Junction. Yes, old. Mr. Placzek?
Yes, under growth, can you tell me what electronic medical record system software you're using?
Yes, we're using Point Click Care. It is a Canadian product, but it's the most widely used product in the United States, and it is very user-friendly.
And will it go to JCMR then? Those
JC.
Jackson
Medical
County
records?
Medical Records?
No, well, it can, but I'm not sure that there's an interface right now that does that. I have talked to Allegiance about the system, and they were excited to hear about it and want to talk to Point Click Care to work on that bridge.
Thank you.
Commissioners, any other comments or questions? Thank you.
Thank you. Oh, and happy holidays.
Thank you. Next on the agenda, we have the Health Department monthly report. Richard?
Good morning, Commissioners.
Good morning.
We have been very busy in the Health Department as usual. Under our administration, my report, just was happy to announce that the internal Health Department leadership team has created a new peer recognition program to recognize staff for exemplary service, and this replaces our Employee of the Month program, which we've had in place for a long time in the Health Department. And it's really about co-workers, identifying co-workers who are performing exemplary service to the public or even to co-workers and having them recognized for that. So I think it's a nice change that we're moving forward with. And staff can be recognized and nominated multiple times, and it's a wonderful opportunity for us to recognize employees for a job well done. So we're happy to put that in place. We do have a new financial services manager that will be serving the Health Department. You may be aware that Latasha Thompson was appointed to the senior accountant position and will be working with us at the Health Department now going forward in December. And we're pleased. We'll be contacting her to set her up with an orientation process for the Health Department and all of our programs and services. Under health integration, I attended a 3-year training. It's a year 3 training, if you will, with Jackson Health Network staff in Illinois, November 6th and 7th. And the training information this time around was really exclusive to the Jackson Health Network to help them work through a whole bunch of related responsibilities in setting up their clinically integrated network. And the key learnings that I came away with on health integration were all brought back to Jackson County, and we'll be working on those further. So I always pick something up from these sessions that I attend with the network that help me think about how best to integrate health-related services into the network. I continue to meet with Jackson Health Network care coordinators, and our most recent meeting was focused on current capacity and the integration status of behavioral health services in the community. We're continuing to look at that. The network has done a very good job of developing a comprehensive health assessment tool that will be part of the Jackson Community Medical Record and will go a long way in helping to assess behavioral health needs among the served client population in the community that the network is serving. The Jackson Health Network staff provided training and orientation to Health Department staff. Approximately 18 of our staff on December 5th last week participated in almost a 3-hour training session, both on the care model of the Jackson Health Network as well as the network itself, how it's organized, its mission, its goals, its objectives, and how it has rolled forward with its efforts. So I think that was very useful for Health Department staff. They begin to understand what the network is trying to do in the community and how we fit into it. The next session that will occur as far as training and orientation is concerned on health integration will be Health Department staff training the Jackson Health Network staff and administrators so they understand what we do and how we do it. So we think once we get to that point, we'll really probably be able to sit down with maybe a cross-organizational team, if you will, and identify the key public health services that would be most amenable to being integrated in the network. So we're excited about moving that forward. The Ad Hoc Community Health Assessment Committee, which we participate in with Prevention and Community Health at Allegiance Health, is met on a third time on November 21st. We have another meeting this week. And as you probably remember from last time, this is the committee of the Health Improvement Organization Coordinating Council, if you will, that gets together about every 3 years, and we do the community assessment report for the community. And also, in what occurs with that as well is a community survey where we survey a wide number of individuals within the community. It's usually a telephone direct dial type of survey. There's some problems, I think, with being totally representative because of the prevalence of cell phones in the community that everybody is using. So we're going to try to figure out as well maybe how to reach out to that group of telephones differently this time than what we did in 3 years ago. So we're continuing to work on a number of environmental health indicators as well within the report. Just for your information, the Michigan Public Health Code is currently a review project underway for that. If there was anything in the code that you might want to bring to the attention of state-level staff, there's an opportunity to do that. I've described the process in my monthly report that you could follow to do that if you were interested. The HSCA Data Action Community Needs Assessment Committee, a third meeting was held on November 20th, and I think the challenge for the HSCA is really to identify within the areas of need that are identified where we can collaboratively allocate time and energy and resource to impact a need that's not already being addressed in some way or another. So it is a major challenge to find the time and the resources to pull all the data together and to decide what to do. But I would make just one comment that one of the items that a great deal of discussion has occurred on has oriented around absenteeism, particularly within our school system, is what we're talking about here, and how that has an impact on all HSCA member organizations, and it even has an impact on health when you get right down to it. So we will probably see something happening with that. The Child Enrollment Steering Committee that I've covered in some of my previous reports is that local committee through the National League of Cities announced the release of the RFP for those cities who participated in the city's expanding health access to children. There was an application submitted from Jackson County through the city, and unfortunately we weren't selected an award for that particular grant, but there'll be other opportunities that I'm sure that we'll be pursuing. Emergency preparedness at the health department, we do a lot with this on a regular basis. We do have our own dedicated staff person for public health emergency preparedness and response, just so you're aware of that. We do participate in tabletop exercises. We also have been doing a lot of work lately with closed points of dispensing. A closed pod is basically a location in the community. It could be a long-term care facility. It could be the Center for Family Health, where those organizations basically agree to become a point of dispensing for either antivirals or vaccines in the event of an emergency, and it relieves us from having to serve those people that those pod sites could serve through the public sites that the health department would normally organize and staff up. So it's very helpful to have as many of these as possible in place, and we've been making a lot of progress on it. We did participate in a SNS, which stands for Strategic National Stockpile exercise on December 4th. It went very well. The primary focus of the exercise was a simulated influenza pandemic, such as that we experienced with 2009, but certainly that one didn't turn out to have a huge number of cases and a huge number of deaths. This scenario was a little more difficult to deal with in terms of the number of people infected and the case fatality rate. But suffice it to say that we were able to modify the portion of the exercise, invoke our incident command system, and also to successfully submit an order for pharmaceuticals and personal protective equipment through the SharePoint site. So it was very successful that way. I'll drop down to health education and promotion. Certified application counseling, we're continuing to develop our standard operating procedures and manuals for that function. We're also working with some other health departments within our region, if you will, our area, that are doing this as well. So it's helpful to have some teleconferences occasionally to share ideas and talk through some of the questions that we all have. But it's going okay. Childhood lead poisoning prevention program funding, I think I mentioned last month that we have been allocated $7,500 from MDCH for outreach and education-related activities. And I probably indicated as well that additional funding might become available in the future. That funding has now been communicated to us, a total of $20,000 within Prosperity Region 9. Now, if we tried to share this across 6 health departments, we probably wouldn't be particularly effective in getting anything more done with that small amount of funds. But in our work so far, we've found 2 other health departments within the region who are interested in working with us, and we're developing a proposal to submit by December 13th this week, and we're hopeful we'll get some additional funding for that purpose. Teen Pregnancy Initiative hosted a re-engagement meeting on November 12th, and that was very nice for the folks to get together and re-engage and recognize the important work that they've been doing and the success they've had. The Healthy Store Coalition is a subcommittee of the Health Improvement Organization's Nutrition Health Action Team. They hosted a nutrition awareness and education event outside Greenwood Food Market on Thursday, November 7th, and the purpose was, to give fresh fruits, food samples, nutrition guides, and healthy recipes to community members as they entered the store. And down at the bottom of that paragraph, I think it's really significant to see what's happened in terms of average sales. According to the state's WIC Fresh Fruit and Vegetable Report, between May and September of this year, Greenwood sales in particular increased an average of $41.59 a month for an increase of 12%, and Keys Log Cabin sales increased an average of $30 per month for an increase of 16%. So it is working to work with our local convenience stores and to try to create opportunities for people to get more access to fresh fruits and vegetables. A few items under environmental health. Field staff are beginning. They're probably already pretty well underway. The end of year soil erosion inspections prior to ground freezing. We need to get those done. I think there's no problems there. We're probably accomplishing all that. Don Haydock, our new EH director, attended the monthly Township Supervisors Gathering hosted at Cascades Manor, and that was a very positive event for him to have attended. And he made some additional contacts, including that with the Jackson County Agricultural Response Team, and that team is seeking to provide large animal handling training to local law enforcement, probably associated with emergencies and other events. Don will be highlighted in a short biographical article in the Citizen Patriot, if that hasn't already happened soon. And I've requested a meeting with the City of Jackson Neighborhood and Economic Operations Department to talk about public health matters of mutual interest, and certainly lead risk assessment activities and housing maintenance were probably up there on our list. We want to do what we can to ensure safe housing for residents. We had a very successful reunification of an aged Great Dane dog and its owner after 4 weeks in foster care during the week of November 18th. We're always happy when we can reunite people with their pets. And we had a couple of fundraising opportunities. One involving Western Options Alternative High School. They selected the animal shelter as their community service project, and we're very pleased to receive whatever they were able to raise and donate. And we do have a holiday fundraiser that will occur on December 7th and 14th at the shelter, and you'll probably get more information on that as a flyer has been developed. And I think it'll be very positive. We get a lot of support from the community for shelter needs. That's my report.
Commissioners, any comments or questions regarding this report? All right, moving on to the next item. Richard, I see you're going to present to us the agreement. We have the agreement in front of us, Board, for the First Amendment, the Health Officers Service Agreement with Allegiance Health, extending the agreement for 1 year.
I move to approve.
We have a motion and support. All in favor say aye. Aye. Opposed? All right.
Thank you.
And before you leave, I must commend you on your collaborative efforts within our community, Richard, though. I'm seeing you at more and more meetings that I'm going to in a variety of different areas, and you're reaching out and extending on behalf of the county is very impressive. Thank you.
Thank you. Pleased to be able to do that.
Next on the agenda, we have Veterans Affairs, the biannual report. Mr. Wellahan. So, Mr. Wellahan, just so you are aware, this was just added to the agenda.
I am aware.
So we do apologize on behalf of
But no one's
the-
read the information I sent them already.
Well,
Okay, that's all right.
Some-
All right. I don't think they did, well, never mind. Sorry, no, I'm kidding. Well, then we'll all go through this together then, and I'll be as concise as you need me to be. First item that I put on here is some information about the new state agency called the Michigan Military and Veteran Affairs Agency. They have separated Michigan Military and Veteran Affairs, so now the Veteran Affairs Agency is a standalone organization. They're the ones that control the money that goes to the service organizations such as the American Legion, the VFW, the DAV, Military Order of the Purple Heart, the organizations that are stationed in the regional office in Detroit that files the claims for our veterans in Michigan to the VA. The goal in this whole program is the state of Michigan is eventually going to take this program over themselves. The veteran service organizations will probably just be in the regional office, not out in the field. I talked with Rob Price, who is the deputy, I guess, director of the new agency, and he said that the goal was eventually to become a state that writes the claims themselves, either through the county offices or through state employees, similar to what the Tennessee Veterans Commission or the Texas Veterans Commission is. They're all trained and qualified, certified, accredited through the organizations such as, the service organizations such as the Legion and so on, by VA, but they're state employees. So that's years to come, I think. Right now, we're just trying to weed through where we're at now with the program. The benefits for us at the county level could be that the state is offering us IT support with a new program called VetraSpect. It's the program that the Coalition of Service Organizations is already using. The state is using this program. It's a web-based program that we can use for filing claims directly to the service organizations in Detroit. No more paper trail from our end unless we make copies to keep, but it's stored in the computer, backed up in the programs through the VetraSpect people that own that program. All the 5 major service organizations, the group that the state of Michigan refers to as the Coalition is the American Legion, the VFW, the DAV, the Military Order of the Purple Heart, and the Marine Corps League are all using that program and have been for most of this year. I did an application with the state last week for us to also have that program in our office so that we could stay on track with everybody that's using it. They forwarded a memorandum of understanding. I forwarded it to Mr. Overton so that he can deal with it however they need to. The other thing that the state would do, because there will be certain documents that need to be downloaded into that program, if we were to buy the scanner, they would pay us back for the scanner. If we were to buy a signature reader that could sign right directly into the program, the state would pay for that as well. So all the technical, the hard equipment or the other programs with the IT, the state will provide to the counties at no cost. Most of the counties are on that program now. We're kind of our office does not belong to the Michigan Association of County Veterans Counselors, so we're kind of the redheaded stepchild in the state where we're the last to know or the last to find out or the last one to be equipped with things. So, and I asked that question specifically because knowing that we're not an at-will state, if that was part of the problem, and they said no, it's just that no one from our office has asked for it, and I said, well, why did anybody else not tell me that? So anyway, beyond all of that, we're rolling and we're on track with that. Another nice thing about that is we're using a program now called VIMS. It's through Sterling Solutions. It stands for Veterans Information Management System, and that's costing us $700 a year, and we may be able to eliminate that program if we get this new program too. So under number 2, we now have a work study in our office. Michael Heskett is a service-connected disabled veteran. He's in taking classes at Jackson College under VA's Chapter 31 Vocational Rehabilitation Program. He's been in our office now about 2 months, and he's been quite an asset. The VA drug their feet. We did the application when he first started the semester in September, and it was long about 1st of October, middle of October, before they authorized him to work. So he was already halfway through the amount of time, because they only limit him to 25 hours a week or so many hours per semester. He was already halfway through the number of hours that he was allowed to work. So we'll have him back next semester. We'll request that they authorize him. The 12th is his last day because unless these students are actually in school, VA will not continue paying them, so that only while they're actually in school. So we'll lose him on the 12th. He'll come back in after the 1st of January when school starts back up. The nice thing for us, it doesn't cost us a penny. VA pays him. They pay him directly through his benefit. They only pay him minimum wage, but it pays through his benefit, so it still becomes tax-free for him. So it doesn't cost us anything. The downside to what we've got going on in our office right now, back in April, was when we had a board position open for the Korean War veteran. Even to this day, we have not one Korean War veteran that's applied for that position. So Bob Sales, who's on the board now as our Korean War veteran, has agreed to stay on board until we can find somebody. But we're soon coming up to look for a Vietnam veteran to board position being open, so I don't know quite how we're going to handle that. I've called some of the commanders of the Veterans Post that I know personally and asked them to talk to some of their people. We've sent a second round of letters out over the summer trying to get some interest generated in this position. But you got to realize that these guys and gals are all in their 80s now, and the next problem we're going to have is in 3 more years when we replace the World War II veteran. The one that we have on staff now on the board is 86 years old. And, of course, by 3 more years, they're all going to be getting up in their later 80s or maybe even in their 90s, which many are already. So we had that problem a few years ago with the World War I vets. Sir?
I thought we were given an option to waive that when we couldn't find someone, that we were able to find an alternate as long as it was a veteran who was willing to serve.
Well, that's why we and that's why when Bob said he'd stick around, we just thought it would be all right to leave him on the board because he's already got the experience and he enjoys being there with us and making these decisions for us. So that's why.
He's not willing to be reappointed?
Well, I suppose he would be, but he's already done 2 terms, so he was kind of thinking that the board probably wouldn't reappoint him. So because that's been the norm over the years, 2 years max for any one person. So, but we could do that absolutely. I could throw that application back at you, and. I think you're right. So we could come in with somebody else, maybe we'd end up with 2 Vietnam veterans on the board or something like that. Well, we ran into that with World War I, too, because just until, was it this year or last year, they finally changed it from World War I. Now, what are we going to do when the World War II vets are all not able to do it anymore? Well, I think we're going to have to break down the Persian Gulf era to Desert Storm and then Persian Gulf, or Desert Storm and Operation Enduring Freedom, Operation Iraqi Freedom, something like that. But that's up there. The Lansing controls all that. That's a state law, and the state is the one that's going to have to make those amendments. So I just keep people on the board so we can get our decisions made. Okay. Yes, sir. We're still working with plenty of partnerships in the office. We've had a little break in service from the counselors that have been coming down from Dearborn. The VA came up with a bright idea that they couldn't come into a non-VA or non-federal facility to do their job. So we've gotten through that. We do have the combat counselor coming into our office once a month right now from the Dearborn Vet Center. And we also have a counselor coming from the Detroit Vet Center. It's a female counselor, and she's the only certified counselor in the VA system outside of the hospitals. The vet centers they're operated by the hospitals but not considered part of the hospitals. That is a MST, or military sexual trauma counselor. And we actually have 4 females and 1 male that's meeting with her once a month now. January, we're going to start having her come to the office twice a month so that we can get these people in. She likes group programs. We may set something up like that. But she's in our office the 1st and 3rd Thursday of the month. The other counselor, actually, he's been twice, but not now, just once because of the holidays and everything. But he comes the 2nd and 4th Thursdays of the month. So we still have a homeless counselor that comes in. She's in Jackson County every day, Kate Hardwick. She primarily is based out of the clinic. She's a VA employee from the hospital. She takes 1 day a week in our office. She comes to our office whenever we need her. She'll come up there. We can just call her. She's actually asked us if she pops in sometime because that's the only place she can meet conveniently with a veteran. Then, of course, we've always offered her office space. She has a half a day a week. She works in Hillsdale because she's the VA contact person for Grace Hope House, I think it is, down there in Jonesville. So she works one half day a week in Hillsdale County, but most of the time she's either in the library, she's at McDonald's, or she's somewhere in town if she can't meet them at the clinic or in our office. So she's done a tremendous job. She's been a huge part of what we've been helping with the homeless veterans, which there's probably a few more than what everybody realizes. So now the new big law that was signed into, bill that was signed into law on November 12th by our governor, exempting 100% disabled veterans from property tax payment. The difference in this law, before, a veteran had to be 100% permanent and total with special adaptive housing grant, which is the 0702 grant, because he had loss of one leg or both below the knee. Okay? The governor's new law that he signed in says any veteran with a 100% disability that's rated permanent and total. There's two levels of 100%. There's 100% and then there's permanent and total. Permanent and total is the final, the top stage where they're entitled to a license plate for their vehicle. It's a 5-year plate, costs them $5, disabled veteran license plate. Property taxes and so on. Fishing licenses are free. Hunting licenses are discounted. But any veteran with a 100% permanent total disability now gets tax exemption from their property tax at 100% clear slate. Any veteran that still has that 0702 grant would still qualify. And any veteran now that's been deemed unemployable, which would be a rating by the VA that if a veteran was 60% for one disability, and he could apply for unemployability based on the fact of the severity of his disability. If the veteran was 70% or higher with a combination of disabilities, one of them being 40%, then he could also or she could also apply for unemployability. Most cases we see the veterans that qualify for that would be in the 80 or 90% range. We actually had a veteran here in the county that was wheelchair bound, an Iraqi vet. His VA disability totaled 240%, and they were only paying him at the 90% rate because of the combined convoluted mathematical system that they used to put all this stuff together. So we did the IU claim, which is individual unemployability, got him the unemployability rate and permanent and total status. However, this is really going to cause some issues. I'm excited as all get out as a veterans advocate that this finally went through. It's been sitting on the governor's desk since March. But as a county employee, I'm a little bit worried about where we're going to end up with this. I don't have, the other one that I didn't even mention yet is the surviving spouse of a veteran that may qualify at a 100% rate, permanent and total, or unemployable, may also apply for this tax relief if she lives in the same house and she has not remarried. Okay, so there's four levels of veteran status or surviving spouse that could get someone tax exemption. If they get it done before the end of the review this month, they'll get a 2013 exempted and paid back to them if they've made any payments. But then, just like any other year, they have to apply between the first of the year and the end of March board of review to become exempt, and they have to apply every year. It's not something that once you apply, it's automatic. Right now, I'm looking at roughly 258, 260 veterans that may qualify. I have 120 of them that are permanent and total, and 138 of them that are unemployable. Now, that's only the ones that we've worked with that we have in our computer system. The vets that go to the hospital in Ann Arbor and work their claims with the other organizations, or the veterans that have moved into the community, the veterans that have had it long before this computer program even was put into the office and was being used. I have no idea how many to tell you, probably upwards of 300, maybe plus. And there's no way to gauge or calculate how many surviving spouses might qualify. I've got in my head probably 8 or 9 of them that I can come up with, but who knows other than that how many more could be. So as a county employee, I'm a little concerned about this, what this is going to do to our budget. But good for the veterans and their families. I mean, this is a wonderful thing that the governor finally did this, because, like I said, it's been sitting on his desk since March. He wanted to sign it real close to Veterans Day, so he signed it on the 12th of November. But I don't know where we're going to end up on this whole thing. I had no graphic for you this time, but yes.
I just have a question on the disability. Does it have to be combat-related disability, or is it just any veteran that's 100%?
Any veteran
disabled
that
and-
serves in the military can make a disability claim for an injury, a residual of disease, or anything that happened while they were in service, okay? Whether they were in combat, peacetime, or during a period of war. So some of our 100%ers, believe it or not, are peacetime veterans. So, no, to answer your question directly, combat has nothing to do with it. It's direct service connected, okay? Sir?
How difficult is the application process?
Simple.
Oh, good.
Actually, and I meant to bring this up, when the law came out, the state said they were not going to standardize an affidavit because an affidavit has to be done, a minor application, and presentation of information that verifies that they qualify through the VA at 100% disabled, permanent, and total, okay, or unemployable. Now, every year at the end of the year, they mailed them out last Monday on the 5th, so most of them have gotten them either towards the end of the week or over the weekend, a summary letter that indicates who they are, where they've been, what they did in the service. Are you service connected? Yes. What is your rate? 100%. Are you permanent total? Yes. Or unemployable, permanent total, and so on. That can be used as well as anything can be used from the VA as evidence of their qualification or their rating decision. I've talked to many in the last week, believe it or not, many townships about assessors about what can we use and that sort of thing. Then the affidavit, the state has actually standardized an affidavit. One of the other townships had sent me a copy of it that was standardized through the tax commission, not through the military or veteran affairs agency. So the difference between that affidavit and the affidavit that had been used by the state based off these 702 grants for the special adaptive housing, so this one doesn't even have to be notarized. It's just completed, information's put in, signed off on, as any other document. Once you sign it, it becomes, I certified, true to, and all that. So I don't know if all the townships have that yet. I haven't had a chance to talk to Ruth about any of this yet, so I don't know where they stand on it. Some of the townships had an affidavit in hand that they use, and if they feel right now, and I'm talking to this fellow at the state, Rob Price, it's pretty much up to the counties how they want to do it. He says the treasurer will have the bottom line on that whole thing. And then he actually said to me, now dig this, the law says any veteran, 100%. He says there's 100% veterans out there that still have a job, right? And I said, well, sure they do. Because even though a veteran may have a rating of 100%, doesn't mean that he's catastrophically injured. May still be functioning and still be able to be a member of society and have a job of some type. So he says if a veteran's making, say, $60,000 a year, he can pay his taxes, can't he? And I says, yeah. He says, that's up to the county and the township then to tell him that you have enough money you can pay for your taxes. That's not what the law says. The law says any veteran, 100%, permanent total. So they're contradicting themselves. They have no idea what to expect out of this either. I don't think that the downside of it is the state put this whole thing into play and never made any amends on how they're going to pay back any of the counties or help support the counties or fund it or anything. So it's kind of a sticky wicket right now. I mean, no one, even the counties, the state, and the townships, and I don't think any of us really fully understand or know what to do or how to handle this claim right now.
Commissioner Rice?
Hey, Dave.
Hey.
Obviously, there's obviously the physical health of the veteran, but this, I take it, would include, obviously, there's, and it has been for many years, post-traumatic stress disorder has been huge as a claim by veterans. Mm-hmm. Obviously, the suicidal rate is unfortunately enormous. So an individual could be considered or deemed 100% from mental health related involvement in the military as well?
Oh, absolutely. It doesn't matter what the rating is based off from, 100% permanent total. Whether it's TBI, whether it's one issue for ischemic heart disease or a combination of issues, maybe diabetes and all the secondary issues. There's no stipulation on that as long as the rating is at 100%. So there was no stipulation. And to make a comment on what you said about suicides, if anybody heard my presentation on Veterans Day, more than once a day we have active duty military people. Actually last year in 2000, or this year in 2013, we had more suicides in the military than we had deaths in Iraq or Afghanistan. So, anybody else?
Commissioner Duckham?
Do you have any, has the state done any projections on how much revenue the counties or townships will lose with this disability?
Nothing's been said about that I've seen. I mean, I've just done some quick calculations, and I don't even know what our average is here, but if we're looking at $2,000 as average, we're somewhere between $500,000 and $750,000 just in this county. And that's small compared to some of the other counties, probably.
I mean, I like the concept, I really do, but
they put no forethought into it. What's it going to actually do?
yeah.
Right.
yeah.
Our governor is like, I'm the hero.
And on that line of thinking, the unintended consequences due to the lack of the county's revenue. And in addition, several of us heard Senator Caswell speak this weekend, and he was mentioning if you make it to your, I believe it's the Township Board of Review, again, as you said, this can be for the 2013 tax year.
Yeah, and I think it's probably tomorrow. Most county or township board of reviews, maybe Friday. I heard on a couple of them.
That's what we were discussing, either this week or definitely next week at the latest, but
the
several
10th,
are this
most
week.
of the people told me the 10th, which is
This week.
tomorrow, is the end of their board of review, but two others told me Friday, so. But, yeah, I mean, if they get it done this month or this week, they can get exempted for 2013. Now, the law specifically says, no matter when your rating was, you cannot go back before 2013 and get exemption, but exemption could come for this year, and even if you paid it already or summer tax and paid half of it or something, the townships and the counties have the responsibility to refund that money.
Well, Dave, I know we'd appreciate any insight or information you have to forward on to us so that we can keep track of this matter.
I've been trying, but
thank you.
It's sporadic right now. We just don't know.
I'm not surprised, huh? Commissioners, any other comments or questions? Thank you, Dave.
Thank you. Merry Christmas.
Next on our agenda, I need a motion to pay the claims from November. We have a motion in support. All in favor say aye. Opposed? Passed unanimously. We have the other meeting minutes included in our board packet. We have the January reporting schedule. In January, we hope to see the Department of Aging, Health Department, Lifeways, Animal Shelter, and Community Action Agency. Moving on to the final public comment. Is there anyone who would like to make a comment? Seeing none, are there any committee member comments? Seeing none, move to the call of the chair.